Raise your hand if you use a glucose monitor, a CGM. Okay, again, I am a firm believer. If you want to have success to reverse your diabetes or your insulin resistance, you need to know how your body responds. Perry said it. If I saw something that increased my blood sugar, I got rid of it. It's as easy as that. We don't have to do the, well, what about this or what about this and be guessing anymore. If it raises your blood sugar, you eliminate it. So, this is from the original seminar that you all attend. We highly recommend it because it can monitor your blood sugar continuously, minute to minute, hour to hour, day to day. And now it sends our information directly to our phone or a monitor if you need that. It gives you direct feedback on your dietary choices, and it can alert you to highs or lows. It allows me or Lindsay or whoever to review your progress. And we like both Libre and Dexcom. We've got some in the back for you. Most of this discussion is going to be from the Libre app, but the same principles apply to the Dexcom app. So, a normal non-diabetic blood glucose range is typically between 80 and 110. A low almost always will occur due to a medication, something that is stimulating insulin, or a high insulin spike after a blood glucose spike. You can see this person started here. After a high spike, the insulin drove them even lower. Highs, of course, are from too many carbohydrates. We like CGMs well over frequent finger checks. It's like checking your blood glucose every couple minutes. Okay, so if you have a Freestyle Libre, there's this options tab that you can click on. And I'm going to go over the majority of each one of these settings here. So the first is the home page. This is going to tell you where you are right now, and is going to show you the past 6 to 9 hours. On the Dexcom, it's the same. And on the Dexcom, you can flip it to the side and you can go a whole 24 hours on the home page. Logbook is the next thing. A lot of my patients use the logbook to do two things. One is to log what they've eaten or what medications they've took. The second, they use it to say what they did that caused this abnormal blood sugar. The logbook will also keep track of highs and lows. You can see on this logbook, this person had a low of 53 at 7:40 a.m. So the logbook is very, very important to you so you can learn from the past. Alarms. Please, if you've worn a Libre or a Dexcom long enough, you've had your alarm go off, probably when it shouldn't have. So know that you can adjust the settings on your alarms, but the program has its limits on what it will allow you to change it to. So for example, it's not going to let you get rid of the low glucose alarm all the way, but you can set your parameters. If you want your high glucose alarm to be 200 or 160, you can change that so that it alarms you for that. If you want to turn it off so it doesn't alarm you at night, because who's been woken up at night because they've laid on their glucose monitor? This will not turn that off. You have to actually go in the settings of your phone to turn that off. So when I wear it, probably 1 out of 10 nights, it'll wake me up. So I've decided when I go to bed, I'm not going to be checking my phone. So I'm going to turn off the notification on my phone. And then when I wake up, I'll turn the notifications back on. Okay, daily patterns. This is very, very important to be looking at your daily patterns. You need at least 7 days to be able to see what your patterns are. The mark in black is it takes an average of what you've been doing out of all the days. Then you go out to the light blue, that's your majority average, like 80% of the time where you are. And And then the light blue shows where your outliers are seen. The most common pattern that we see is the dawn phenomenon, where someone is waking up and their blood sugar is rising, or what I call the nighttime snack phenomenon, where it's 8 p.m. and your blood sugar is going up. Well, you've got a problem with snacking before bed. So it's important to see what your patterns are, and it gives you feedback for what your behaviors are. Then you need to think, are there any cues or triggers that is causing me to do that? Okay, let's go to the settings. Almost all the time I go to this report settings part where it says 70 to 150 and adjust that for you. The default is 70 to 180. I usually change it to be in range either below 150, sometimes even below 140. I've got some really, really strict people who try and keep that range even under 110. But most people between 70 and 150. Time in range. Time in range is a direct result of what you set that setting to. So if you adjust your setting, it will change what your time in range percentages are. I really, really, really want to emphasize that you should be as close to 0% on your above 150 as possible. And I'll show you that here in a minute, how we can look at that. Time above range is the best indicator for me when I look at this of insulin resistance. So I've done this with many of you where we kind of draw a line or we put a piece of paper and we cover up everything below 150. If I can see only very small parts of time where you're over 150, time in range is key. Now in this case, in this example, this person was kind of pushing the 150 mark a couple times, and then again had a high carb meal that spiked them above, but it came down quite quick. This person does not have significant insulin resistance, and that's why it came down so quickly. This is what 99% in range looks like. Despite having some peaks and troughs, which we'll talk about here in a minute, this person's glucose levels were kept in range quite well almost the entire day. Let's talk about the average glucose tab. This is a very, very good indicator. The first thing we look at down here is this bottom. We know that you're making progress if your 90-day glucose and then you go to your 30-day average is less than your 90-day, and then your 7-day is less than your 30-day. We know that you're having success. This may be one of yours, by the way, but this shows a very, very common phenomenon, which is the dawn phenomenon. This person is waking up and peaking their blood sugar before lunchtime. And what's happening is they're trying to do a low-carb diet, but their body is releasing extra sugar. This is very common. It is not a problem, but it's important to know that this is happening and is what is keeping the blood sugar elevated. If we didn't know that this was happening and your A1C is coming back higher than you expect it should be because you just check your blood sugar right in the morning and right when you go to bed, you would never know that this dawn phenomenon is occurring. Now, it's also how this GMI that we're going to talk about. Sorry, we'll talk about GMI. Oh, nope, I'm going to talk about the daily graph, I guess. Okay, daily graph. This is where I go to first. When you give me your phone, I'm like, give me your daily graph. Let's take a look at it. I'm going to go through day after day, and I'm going to look for patterns. I'm going to look at the good days, and I'm going to look at the bad days. I'm going to look for the Mount Everest days, and it's so funny. I pick it out and I find this day, and they're like, oh, I can tell you, Dr. M, I know exactly what caused that. No, you don't have to give me the reasons, because I already know. You had a Mount Everest, okay? We want to avoid Mount Everest. This person started at a about 110, and within 20 minutes, their blood sugar was 350. You can see that it took about 6 hours for that blood sugar to resume to 150. That is severe insulin resistance. This may have been something really little, like a sandwich, and that's it. It could have been, I had 2 cookies. When you have severe insulin resistance, this is what happens, but this is what you get that feedback from. Here's another Mount Everest, and in this person that has severe insulin resistance, their baseline blood sugar is about 150, and so the second they even look at a carb, their blood sugar goes up. And you can see again from this that this person didn't have any breakfast, so they were kind of going along okay, had a very high carb lunch, and it started coming down, and right when it came down, they just had a little bit more carbs for dinner, and then that's why they ended up waking up, going all the way through the night. If you looked at their next day, 200, 180. So now I'm going to talk about the subtle things that we want to look at. I showed you this little day before, but I'm going to give you how to even improve upon this, because this person's A1C is coming back around 6.5. Their average blood sugar might be 130, 140. So, number one, they have a very subtle dawn phenomenon. You can see that they wake up, their blood sugar spikes when they wake up and then comes back down. Subtle, but there. A small blood sugar spike at breakfast due to some extra carbohydrate. A large spike at lunchtime, and then look at this very, very slow return to baseline. This was a meal with some good protein and some good fat and some good fiber, but a decent amount of carbohydrate tucked in there. And look at it took 3 or so hours for that to get processed in the body. Then there were multiple spikes over dinner and before bed, causing multiple episodes of insulin. So anytime you see a drop down like this, here, and there, that is high insulin production, okay? So that means insulin resistance is still occurring because of that. Okay, now we'll talk about percent GMI. It's just a term that they've created. Glucose management indicator. They can't say A1C because it's not an A1C, but when you get your A1C checked, you need to know it is just a calculation as well. It's just a percent of your blood that has glucose attached to it. That's all it is, a percentage. It's the best way to estimate A1C. So if you've had a glucose monitor on for 90 days, this GMI is as close to an indicator as your A1C as possible. And some of you have done this, right? I look at your 90-day GMI and then we prick your finger and it's like within 0.1 or 0.2. It's fascinating. It's also good to know which direction you're going. So if your 90-day GMI is 7 and your 30-day GMI is 6.7 and your 7-day is 6.2, I'll tell you, okay, whatever you've done the past 7 days, keep that up and you're going to get a 6.2 in 3 months from now. And that's what happened in this person. Look at their 7-day indicator went from a 6.7 to a 6.1. There's a connected apps section. Some of you have shared your data with us. So I technically could spy on you anytime I wanted to, but I don't. But if you say, hey, Dr. Hammer, I've got a problem, could you look at my stuff? Both Dexcom and Libre allow this. The other cool thing is, if you want to have some added accountability, let your spouse or your parent or somebody look at your stuff. You can share it with them. So that's kind of cool as well. Now here's some other tidbits. The pesty alarms, which we talked about, this little red dip, the majority of the time these things are not real. Many of you, I have taught you the nickel trick. So you just get a nickel and tape it on your arm, okay? You can move that piece of tape and move that nickel around different places on your arm, then move around. Go lay down, lie in the position that you normally sleep in, and if that nickel is getting pushed on in your position, then you know it's in a bad spot. So just feel around and say, okay, I'm gonna move that nickel to here, and that's where I'm gonna put my monitor. So you can avoid these, they're called compression lows. They're not true lows, it's just a fault when the sensor gets pinched up against your skin. Next is reminders. There's a reminders tab that you can use. There's a lot of different things. You can do repeating, where it repeats every day, every Sunday. If you're doing a shot once a week, you can have it do a reminder for you. If it's you need to take your medication, or if you need to check your ketones, whatever, set yourself some reminders. And the last thing I'm going to remind you is the more boring your CGM is, the better. We do not want roller coasters. Our pancreas does not want a roller coaster. If I see this, I'm high-fiving you right here. Minimal to no insulin is getting secreted during that time, a stable blood sugar, and everybody's happy.